Have you ever had an epiphany moment in your life that shook you to your utter core, that you wrestled with until you finally had to do something about it just so that you have clarity with your mind? Well, that happened to me after about 25 years of orthopedic practice. My name's Tyler Goldberg. I'm a fellowship-trained orthopedic surgeon with over 25 years of experience specializing in hip and knee replacement surgery. Over the course of my career, I've had the pleasure of performing more than 11,500 joint replacements, helping thousands of people regain mobility and function and improve their life. Today, I want to talk to you about my epiphany moment for why I started the concierge pathway. When I was in medical school, we would sit around, having lunch, and I remember very distinctly an interaction I had with one of my fellow medical students. He was actually an OMFS student, which means he was doing oral maxillofacial surgery, and they are dentists that get shuttled into med school to do a few years of med school training, and then when they graduate, they actually have a dental degree and medical degree all in one. Well, one day we were sitting around at lunch and this guy was talking to me about his practice, and he was like, well, when I'm done, I'm gonna have this very small clinic. I'm gonna have like a barista in the waiting area serving coffee to all the patients. And I was like, hey, I love that for you, but I'm trying to figure out if I'm doing orthopedics or OB-GYN. Like, we're on a different stratosphere here. You know exactly what you want, and I have no clue. Well, it was really impressionable. And fast forward 25 years, I've got my own small boutique little clinic. So I actually have now what he envisioned years ago. So I sort of understand that. And then I finally did a knee replacement on my brother-in-law. And he came to stay with me for 3 or 4 weeks after his surgery. And I lived that knee replacement hour by hour, day by day and at that moment, I sort of realized I had this aha epiphany moment of marrying what he was describing to me 25 years ago in med school to the experience I was having currently going through the knee replacement with one of my patients. And I realized, oh, I get it. I need to boost my game to help these people get through their knee replacement and hip replacements better. And that's really essentially how the concierge program was born. I sort of had a desire planted into me my sophomore year of med school 30 plus years ago about doing a more boutique style of practice. And then I had this epiphany moment that took a career to get through, to be able to figure out how to do it. And at that moment, I obsessed about how I would enter into concierge medicine in the orthopedic fascia.